5 seconds to go. Start. COVID 19 and tuberculosis (TB) are remarkably similar. They are transmissible airborne infections. Both are more likely to spread in crowded settings and harm people with immunocompromising conditions. In the first year of the COVID 19 pandemic, 1.8 million people were reported to have succumbed to the virus. In the decade between 2010 to 20, 1.5 to 2 million individuals died every year because of tuberculosis. Yet, we seldom see the word pandemic used in the context of TB. The amount of money spent by governments for research and development in the first 11 months of the COVID 19 pandemic was 162 times the corresponding amount spent on TB in 2020. The difference in responses to the two pandemics can only be explained by the differences in the profiles of those who get infected. TB disproportionately affects people in low income nations, the poor, and the vulnerable. The increased burden on healthcare to manage COVID has led to a serious setback in TB control. Before the COVID pandemic, it was assumed that a third of all individuals with TB were undiagnosed and were likely spreading the disease in their communities. In the past 2 years, case detection has dropped, suggesting that the proportion of such missing cases is likely to have increased. Lockdowns, the fear of healthcare establishments, and the stigma associated with respiratory symptoms have possibly contributed to the increase in missing cases. For those diagnosed, access to medicines has not always been easy. The redirection of human resources within the health system during the three COVID waves has left TB facilities understaffed, leading to poorer quality and delayed care. Studies have suggested that COVID may trigger pathways leading to reactivation of dormant TB bacilli. Historically, turmoil in society, such as wars, food insecurity, poverty, and malnutrition, have resulted in surges in the incidence of TB. We could therefore witness an increase in TB in the coming years. On World TB Day, we need to ask how best we can leverage the lessons learned from COVID 19 to help gain a new momentum in TB control. We need to focus on the epidemiological triad agent, host, and the environment. Stop.